So how I'd like to do this is I'd like for you to follow along on my presentation that I'll attach to where I submit the project. And I have visuals and I have information on the slide, and I'll read it and talk about it on this video. But I want to do it so you follow along on the slide while I do it. So I did ACL tears, causes, symptoms, and treatments, understanding a common and debilitating injury. And on this picture, it's of a torn ACL. So it's one of the middle ligaments of the knee. And introduction. The ACL tears are a common sports injury affecting athletes in activities like basketball, football, skiing, and soccer. Approximately 200,000 ACL injuries occur annually in the US, with about 100,000 reconstruction surgeries. These injuries often result from pivoting, cutting, and sudden changes in direction. So the picture I have here is of Robert Griffin III tearing his ACL, and he was turning around and pivoting to go pick up the football, and his knee ended up caving in and he tore his ACL. And that's a pretty common position to see people tearing their ACL in. Causes of ACL tears. Non-contact mechanisms, sudden deceleration, rapid directional changes, or landing from a jump. Often involves anterior tibial translation, which means that the tibia will move forward in relation to the femur. Valgus stress, which is when your knee, I'm gonna get up into this, when your knee goes inward like that, and tibial rotation. And it can also happen through contact mechanisms, even though it's not as common. Usually it's non-contact mechanisms. And this happens through direct impacts, such as in football, as a tackle to the lateral side of the knee, which is what's happening in the picture I added. So the guy who plays for the Seahawks is falling on his leg, and just like the Robert Griffin III picture, his knee is caving in and he's injuring, likely tearing in this picture, his ACL. Risk factors are anatomical issues like flat feet and weak arches. So if you have flat feet, your feet are likely going to move in that way and your knee is going to cave in, and that's going to cause just overall wear and tear of the ACL and putting it in a consistently stretched position, which will weaken it. Also, weak arches. So wearing a lot of footwear that doesn't allow you to work your feet can result in weak arches. And another risk factor is poor training techniques, especially with improper knee alignment. Symptoms of ACL tears: intense knee pain, swelling, and a giving out sensation. Difficulty with range of motion, bending, or straightening the knee, which you see in this picture. This is after an ACL injury, and he can't fully straighten the knee yet. Hemarthrosis, which is bleeding within the joint, which causes swelling, and a loud pop sound at the time of injury. It usually occurs, which indicates a complete tear. Diagnosis of ACL tears. Clinical test is the Lockman test, which is the one that is most commonly used. It's used a lot by athletic trainers on the field. If someone thinks they've torn an ACL, it's a way to determine whether or not they tore their ACL. So in the picture, you see the nurse with their hand on the upper femur above the knee joint and then on the tibia. And what he's going to do, or she, from this position, is he's going to pull at the tibia and push at the femur. And if there's resistance there, the ACL is still intact. But if there is too much give and there's no mechanism to pull it back, you don't feel any resistance, the ACL is likely torn, because the ACL is going to stop that tibia from going forward. And also his or their positioning there on the tibia can be difficult if the individual who's torn their ACL, if they're particularly muscular in their lower leg area. So sometimes it'll be a little easier to grab the posterior side of the tibia to do it. More tests, which are a little less conclusive than the Lockman's test, is the anterior drawer test and pivot shift test, which are usually done later than the Lockman test gets done. Some imaging tools are the MRI, which visualizes ligament damage and associated injuries, and X-rays, which can rule out fractures. Treatment options. Non-surgical, so for particular tears or non-active individuals, physical therapy is often sufficient. So more likely than not, if you're an individual who is not an athlete, you're going to opt more for relying strictly on physical therapy. But individuals who are athletes and want to return as quick as possible, surgery is usually the best option for that. The other treatment option, which is surgical, is the ACL reconstruction with grafts. And they can get this graft from the patellar tendon or the hamstring tendons or donor tissue, which you can see some of the ways they could get grafts in the picture I put to the right. So from the quad patellar tendon bone, from the patellar tendon, from the hamstring tendons. So you can get it from any of those areas, which this is similar to a UCL repair. You get the ligament from somewhere else and put it in. So with the surgical, arthroscopic surgery improves recovery time, like I said. Slide 7, rehabilitation. For the initial phases, you focus more on pain, swelling reduction, and restoring range of motion. So, like I put in the picture to the right, it's a health professional administering manual physical therapy, which is the main mode of physical therapy to use in the initial phases, just to break down any scarring or just fluid buildup in around the knee, and just restoring some range of motion manually is what's going to be best in the early phases. Strengthening and neuromuscular training. So this builds joint stability and prepares for functional activities. And then advanced phases, which you'll see a lot with athletes. It includes plyometrics, agility drills, and sport-specific training. So the timeline is 9 to 12 months for full recovery, depending on how well the adherence to the protocols is. So some prevention strategies is neuromuscular training, where they focus on strength, balance, and proprioception, which proprioception is being able to know where your body is in space. It's also called kinesis, and it's known as the sixth sense. So knowing where your body is in space can be helpful. Biomechanical assessments, which corrects improper landing techniques to reduce risk. And strengthening exercises, which targets muscles supporting the knee. So with the biomechanical assessments, improper landing techniques can really wreak havoc on just your ability to stay injury-free and stay on the court or the field. For example, Derrick Rose, he would commonly train plyometrics, but he would have knee cave on his landings. So he would land with his knee more so like this rather than out. And he had an ACL tear and came back, did PT, and didn't fix those landing techniques. So he re-injured the ACL, and it really sidetracked his career. And in this picture to the right, this is of Squat University, the top one. He's showing foot collapse, which then leads to the knee collapse. And this is how you don't want to land. You want to land with your knee more stacked over on top of your foot. And the foot collapse many times is the thing that leads to the knee collapse. So with the prevention, working on overall foot strength, it can be really important for keeping your knee healthy. And then on the bottom picture is another picture of more or less poor training that leads to injury. So this is Angels. He plays in the MLB. This is Mike Trout, who plays for the Angels, and he was gonna be he was known for being like one of the next greatest players of all time, but he's been particularly injury prone. And when you look at his training, he had been doing this exercise where he runs with a barbell, and you can see here every time after every stride, his heel would hit the floor and then his foot would just collapse on the floor. Like, it was just reinforcing poor habits and poor mechanics, because you want to land with your foot more active, not just your forefoot slamming down into the floor and just no arch, just slamming down. You want to be able to land with a nice arch and really work on better mechanics other than sprinting with a heel strike and then slamming your foot down. So the conclusion, ACL tears significantly impact mobility, stability, and quality of life. Prevention strategies and awareness can reduce the prevalence of injuries. Proper diagnosis, individualized treatment, and comprehensive rehabilitation are crucial for recovery. Ongoing research will continue to enhance outcomes and reduce the burden of ACL injuries. So hopefully after your rehabilitation process, you continue to strengthen the areas around the knee and maybe possibly get to the point where you can do what this gentleman is doing in the picture I put to the right, who this is Ben Patrick, who's known as the knees over toes guy, who had two different knee reconstruction surgeries and was told his knee would never fully bend again. But through training and through just training the knee and slowly building up from a scaled down exercise to scaling it all the way back up to what you see him doing here, he's able to achieve full knee bend, which brings lots of synovial fluid to the knee, which is really good for someone who has had knee injuries in the past. Just bringing that synovial fluid and the blood to that area can be very helpful. And also with the rehabilitation, a lot of the time the first thing that a PT will try to work on is getting the full extension at the knee, because a lot of the time the VMO, the vastus medialis, doesn't want to activate, and that is what brings your knee to that is most active in the end range there. And a lot of the time after ACL injuries, the patient will struggle to get to that full extension. So one exercise I've been seeing through shadowing is they are sitting on a table and they have their leg up on the table, and they put something under here and they work just on that end range just to get the VMO back activated and to just get the ability to fully strain their knee again. And even forcing yourself to sit with your knee more straight out is good, because you definitely don't want to lose the ability to fully strain your knee. And when it comes to having your knee being able to fully straighten, that is an ability you want. But when you're doing things like plyometrics and sport, that's not how you're going to want to land. So landing with a straight knee is another thing that is known to increase the likelihood of an ACL injury. So landing in a good athletic position with strong arches is important. And here are my references.